study finds 1 in 8 patients with cancer had inherited genetic mutations. Scientists with Mayo Clinic Center for Individualized Medicine published their study on JAMA Oncology. They performed genetic testing in over 3,000 patients who were diagnosed with cancer at Mayo Clinic Center locations in Arizona, Florida, and Minnesota. Their research revealed that 1 in 8 patients with cancer had an inherited cancer-related gene mutation. The said mutation would have not been detected in half of the patients using a standard guideline-based approach. In fact, it only identified 48% of the patients with an inherited genetic mutation. Niloy Jewel-Samather, a doctor of medicine, is a Mayo Clinic gastroenterologist and hepatologist and the study's author. Every person has some risk of having cancer. In most cases, it develops by chance. But some individuals are genetically predisposed to having certain types of cancer like breast or colon cancers, Dr. Samather said. A gene can malfunction due to a genetic mutation and cause a cell to become cancerous. The authors studied the effects of a genetic mutation discovery. Their findings reveal that 1/3 of the patients with the highest risk cancer genes had a change in their medical management, including the type of surgery or chemotherapy. Dr. Samather noted that targeted treatment would have been lost if the patients did not undergo genetic testing. Robert Nussbaum, a doctor of medicine, is the chief medical officer of Invitae Corporation and the study's contributing author. In cancer care for both patients and their families, genetic testing is underutilized. This is often due to outdated guidelines that limit its use to a narrow group of high-risk individuals. A lot of mutations that cause cancer to occur happen by chance in a single cell. However, the study confirmed that close to 10% to 25% are inherited mutations that trigger a cycle of events that can contribute to cancer. Finding hidden inherited genetic mutations could open opportunities for cancer management in families and targeted cancer therapies that can save patients' lives, said Dr. Samather. Every cancer patient should have access to complete genetic information. This information will then guide their care and inform them of their family's health, said Dr. Nussbaum. They offered free genetic testing to all blood-related family members of patients that have a genetic mutation. 1 in 5 of these family members underwent genetic testing. The study's findings will then be applied to the care for all cancer patients at Mayo Clinic.